line indicate? The simple answer to what fingernail lines may indicate is that they are very often insignificant. This is especially true when it comes to the vertical line on the nails, which may start at or just above the moons or cuticle and extend upward to the nail tip. Horizontal fingernails line may be more suspect, but even here the lines may be nothing and could be a sign of age or behavior. There are some worst case scenario on other hand that may be worth considering. Most people have vertical fingernail lines and this can be light or have groups. Typically, as people age, groups get a little deeper, but this doesn't indicate health issues. Yet, if the lines of the nails surrounding them get yellow in color and if the nails seem thick, this might suggest as fungal infection. Should this consider persist? It might be wise to see a doctor for guidelines. Yellowing nails may also be caused by behaviors like smoking, but thickening nails or uneven growth might mean a fungal infection in persist, or it may contain a fungal infection. Under many circumstances, horizontal lines are a little more unusual. These lines can simply represent different types of growth and they are little more common on people's nail as they age. Horizontal lines can be fairly ordinary on people who regularly get their nails manicured too. This doesn't mean horizontal or transverse finger lines are always benign. In fact, white arms that are in pairs may be miracle lines, which have been shown to indicate many different diseases or changes to health. Miracle lines can simply be a sign of certain treatment undergone. They are common on the nails of those who are being treated with chemotherapy, for example. In absence of this treatment, wide transverse fingernail lines in pair might suggest extremely low albumin level or some form of cancer. They can also be associated with malnourishment, certain forms of kidney disease, and some illness that could affect the liver. As described, the lines are usually present on the toes too and don't occur very often on the thumb. A single fingernail line with horizontal line is not likely to be an example of Murex line. On other condition that is associated with horizontal finger line is arsenic poisoning. Fingernails may be lined and ridged in transverse fashion, and the lines are usually described as white in color. Again, this may not mean anything, but it has been noted as a symptom of long exposure to arsenic. If people who work around chemicals or have been any reason to suspect any form of arsenic consumption, this is fairly easy to test with the help of physician. Fingernails are extremely important as they can say much about human health. Doctors regularly examine nail bed to check for proper nourishment and even to assess cardiac function. The degree to which any lines on the nail are significant may vary based on the individual's health status. Should people be concerned about unusual line? It makes sense to check with the medical practitioner for the guidelines.